One of the problems of treating patients with psychiatric disorders, and specifically major depression, is that the pathways or the program or the way to deal with the problem is not well done. It's vague. People don't know how soon do you see the patient, when do you start changing the medicines, what do you do for this, what do you do for that. So they're scared of knowing what to do, you know, and that obviously is a deterrent. For instance, patients with hypertension or diabetes, the general practitioners know, you know, you do this and this and this, and you measure that and that and that, and you send them for these blood tests, and you see them this, and you send them to the dietitian and exercise program. But for psychiatric disorders, and specifically depression, they don't quite know how do we deal with this. And so the technology helps them to follow a specific pathway. It's not I mean, people are very scared of protocols and guidelines, and they think it's a recipe. They find it easier to follow a sort of a pathway, which means, you know, it guides them into, okay, do this, and then you can make the diagnosis. Once you've done this, measure the patient, and then you know how severe the patient is. This gives you a guideline in terms of where to go. And then the technology helps you in terms of choosing your antidepressant, in terms of the symptomatology, and it tells you when to make the next appointment and what to do. So once there's technology available, which we have developed, is that the technology assists with structuring the program, you know, when to do what, and how to when to make the next appointment, how to choose your meds, what to do at the next consultation. Do you up the meds? Do you keep the meds the same? Do you change the medicines? Do you add psychotherapy? What do you do next? So it actually aids and makes it very easy for them to follow that nice pathway, and to tell them, you know, it's now 2 weeks to follow up, or 4 weeks, or 6 weeks, or 3 months, and that assists a lot. So they feel very comfortable in managing these patients, because there's really structure to the management.
Yeah, no, definitely. I think most probably that's the way to go. That is the way forward, is to incorporate technology, because that makes things so much easier in terms of helping the professionals in terms of communication, because then information could be on the same platform and people have access to that, and people can monitor the progress of the patient, whether there are particular questionnaires done to monitor and to measure where the patient is for a particular condition, like depression in this case. So the structure that technology provides and the guidance that it provides as to where the patient is, what needs to be done next, is really of great value. And if one looks at the treatment in terms of psychotherapy, that's always been not that easy, because there are many types of psychotherapy and it's not that well standardized. And with technology, this kind of would force professionals in the program, like the psychologist, to actually follow a particular pathway in terms of what to do, and to monitor their own treatment also a lot better. So I think the whole matter of standardization comes into the picture, that really just improves the quality of treatment at the end of the day.